Hello there, guys, and welcome back to Bright Founders Talk from Temi, an international software development company that designs, builds, and delivers software for sustainable businesses and promising startups. Today, we've got with us on our show Sergio Schirmer, tech CEO and founder of Radiolife, a company which has been going for almost 3 years now, I believe, if my evaluations are correct, Sergio. Sergio, before we go into the world of everything that you've been and are doing at Radiolife, I want to know a little bit more about the man behind the machine. So start off for me, maybe a fact or something that not many people know about you.
That's hard because everybody knows I'm Brazilian, but I'm in the US for almost 10 years now. I have 2 MBAs, background in computer science, and very passionate about technology and innovation.
Mm-hmm.
But one thing that not many people might know, aside from my closest friends, is that I play drums.
Cool.
Yeah.
How long have you been playing drums for?
Since I was 16, so...
Oh, wow. And was it something for like a hobby, or was it more like a way to just kind of relax? How did you do it?
Yeah, just, for fun, as a hobby.
Cool.
I used to play a lot with friends in my hometown.
Amazing. Cool. Amazing. You mentioned there about you've obviously got your degrees from college, as you name it in America. Tell me about your time at Stanford. What was the most valuable bit of experience and knowledge that you got from your time studying at Stanford?
Yeah, so it was a short-term course, programming course focused on JavaScript. But it was a really nice experience to be in the Stanford environment. It was, a really good moment for me. As I was coming into the Silicon Valley and living that experience.
Mm-hmm. Okay, interesting. Tell me, what is it like for a guy from Brazil to come into the world of tech to Silicon Valley? Was it as you imagined it? Was it as it shows in the movies? Or did it disappoint a little bit?
It's full of obstacles. There's no, like when you look at the media, social media, what people say, there's a lot of magic. But when you go on the day-to-day activities, you face a lot of obstacles. You need to be resilient. You need to be able to go through all the obstacles and succeed, because it takes time to go through everything.
I can imagine. Tell me, this resilience, is it something you learn, or is it something you're born with?
I like to say, usually I tell people that Brazilians are known for never giving up.
Cool.
So it might be something ingrained in my origins.
Absolutely. Interesting. Sergio, tell me a little bit about the beginning of the life of Radiolife. Where did the idea come from?
Yeah, so my co-founder, Williams, has over 20 years of experience in telecommunications and radio frequency. And we actually met before in Brazil around 2005, between 2005 and 2008. I had a successful exit in telecom, and that's when I met him. So around 2019, we started having conversations about how we could use radio frequency to cause a positive impact on people's lives. That's how everything began, and how the idea came.
And was it as easy to put into action than you imagined, or how was that beginning process? How long did it actually take for you to get the idea into a business?
It took a few years, actually, because we didn't have exactly the understanding of the pains of the diagnostic space.
Mm-hmm.
First, you have to decide what space you're going to play. And we were still deciding, are we going to therapeutics or diagnostics? But definitely in the healthcare space, that we wanted to really bring technology to help people at a global scale. After a lot of brainstorming, we decided to focus on diagnostics and use radio frequency combined with AI to develop fast diagnostics that are like fast. When I say fast, is like under 20 seconds results and reagent free. So that was the idea, because we, after a lot of brainstorming and talking with providers and people from the space, we were able to have a better understanding of the pain points. And one of the big pain points of the space is having to replenish the shelves, the laboratory shelves, with reagents. And this is really hard when we have outbreaks, for example.
Tell me with that example of you said that you really wanted to help people. It was one of your desires as to why you built the business. Where does that come from? Where does that desire to help from? Is it more of a personal journey or just your legacy? Where does it come from?
I think it's like observation of a lot of problems that happened during COVID. I was successful in the tech space in Silicon Valley, working with startups in the Bay Area and helping them succeed, take their products to the next stage.
Mm-hmm.
But I didn't think that was enough. I was happy to be helping startups and definitely causing a positive impact on that front. I wanted to do more, and at the same time, I was seeing like the impact that COVID was causing, like displacing jobs. People losing their jobs, small businesses having to close doors. And all the whole impact, like people losing their lives. Really, we thought we had to, have a better diagnostic tool. It's not acceptable to be susceptible to a virus like COVID. Like, you're feeling sick and you had to travel, but there was no way to really know quickly if you had the disease or not, without putting other people at risk, because you have to go and do the PCR test. You're exposing other people. And then you're exposing yourself if you really don't have COVID, right? So that's, it's just one example, but, it's not just COVID. It's like any infectious disease, it's the same situation.
Mm-hmm. Tell me about that, the beginning process. What did the original MVP look like at the beginning?
It's funny because the first one we used, we didn't have a 3D printer. We used a microwave cage to do the initial studies. Because the microwave has the isolation, the Faraday cage, and then that prevent the radio waves to go out of the cage, and also radio waves from the environment to get in. So that was a funny experiment, and that went well. We got initial good results that indicated the potential of the technology, and then we decided to continue investing.
You're telling there at the beginning, so Radiolife is aiming to reshape the future of diagnosis here with using the radio frequency and technology for AI. What kind of specific breakthroughs do you anticipate in kind of understanding disease and patient care in the future?
I mean, I think, the speed is a big problem because everything requires time, and sometimes don't have time. We need to get fast results so the providers are able to act in time, right? So there are many diseases that I know people just die because they don't have the disease detection in a timely manner, so that the doctor prescribe a treatment. So I think that's one of the biggest, and what I envision in the future is like people using our technology at their own home. It's a long-term vision, but in the future, when you go to your favorite appliance store to buy a new TV, I believe you'll be going back home with a diagnostic medical device under your arms.
Absolutely cool. So you say this is a long-term vision. When is this long-term vision for you?
So we're gonna start selling to laboratories. So the short, mid-term will be laboratories, hospitals, primary care clinics. That it's like from 3 to 5 years a time frame.
Mm-hmm.
And then from 5 to 10 years, I think we can start thinking of bringing this to people's homes.
Tell me, it's been almost 3 years now. What have been the most significant milestones over the last 3 years?
I would say the there are many important milestones, but the first important one was the preliminary study we conducted with COVID, that we got 99.77% concordance rate with the RT-PCR gold standard. And that's what gave us the confidence to continue. But then we got our patent grant. That was huge. And then after we got our patent grant, we were accepted in a Future of Healthcare Acceleration Program provided by the Roux Institute, which came with a seed investment in our company. So that was super important for us, as well as connecting us with the main healthcare companies in the state of Maine, like Northern Light and Maine Health. And now we are focused on developing diagnostic tests for E. coli. E. coli is a segment that is set to hit $3 billion by 2030. So it's a significant space. It has one big problem. Like the standard turnaround time for a diagnostic test for E. coli ranges from 24 hours to 48 hours. Yeah, and then compare that with 20 seconds, which is what we are aiming for.
Wow, amazing. Okay. Tell me, so you're talking there about the milestones, but a company and a startup never comes without its challenges. What has been the biggest challenge you have faced?
Honestly, it's bringing investors in. It's really hard. Like people just want certainty, and then it's
in a world that's not certain.
We are developing something new. So I already invested over $350,000 of my own private funds from my prior exit in telecom. But medical diagnostic device development takes a lot more than that to be able to, hit the market. We need to go through clinical trials, which is really expensive. So we are really slowly finding the right people to partner with and bring them on board. And that's, definitely the biggest challenge.
Tell me, in terms of tech, with AI, what has been the biggest tech AI challenge which you have faced? So you said more on a level of less kind of organizational level of trying to get those people to believe in you and the investments. What about on a tech level? What's been the hardest part, the biggest challenge?
I mean, technically speaking, I don't see challenges. We have to make sure we combine the right tools. That's for sure. So take our time to, explore different technologies, analyze the data and make smart decisions to choose the ones that present themselves as a better option. So that's constant, I think in that sense, the biggest challenge is finding, the right people that will have that mindset.
Talking about the right people, the mindset, how big is your team now? And have you managed to find those people with that mindset?
Yeah, we have a small team of less than 6 people. It's a combination of founders and, advisors, mentors, and consultants that, decided to partner with us for equity. But, leadership teams, me, my co-founder, electrical engineer, Dr. Rodrigo is a microbiologist, and Michelle, she's a regulatory compliance advisor with over 20 years, have worked with Johnson & Johnson and AstraZeneca. So that's the leadership team. And then we have also developers, electrical engineers that help with the, hardware, prototype, building, designers, but a really small team at this point. We need to make sure our burn rate is low until we're able to raise enough funds to go through clinical trials.
Absolutely. I mean, this is one thing I hear on the show a lot, that it's a very difficult kind of decision to understand when to expand and when not to expand. If you do it too early, you're wasting money. But then if you do it too late, then you're wasting time and development. So difficult challenge to go through for sure. Tell me, Sergio, in terms of moving forward, are you happy so far with this year's success? And What do you need to do to finish the year off even more successful?
This year has been absolutely the best one since we began. Just for going through the Future of Healthcare Acceleration Program and connecting with mentors, highly skilled mentors, really helped us refine our go-to-market strategy. So now we have a solid fundraising strategy and go-to-market strategy, as well as a regulatory path. So we're super excited with the next steps that we're going to face. But at this point, we're focused on getting the study for E. coli completed. That is being done in partnership with the Institute of Experiential AI from a grant that we were awarded. And once that's completed, we're probably going to publish the paper, try to get a peer review. And, next step will be filing for FDA breakthrough designation. And once we have enough funds, begin clinical trials.
You said at the beginning, not at the beginning, throughout this conversation today that obviously this is not your first venture. You have had your own startups and been CEO before. Tell me, what has been the difference between that challenge and this challenge? And also, what did you learn from those years to bringing it into the life and the world of Radiolife now?
Yeah, so the main difference is the first company I built, I was 20-something years old, and now I'm 42. So definitely learned a lot since then, but I learned a lot from that experience as well. I think I didn't have a really good, by the time, I didn't have a really good idea of what is a lot of money. And how much money you really need to go through, to build a diagnostic medical device, which I'm still learning, but, a lot of lessons learned along the way.
Tell me, what has been your biggest lesson as an entrepreneur, CEO? What have you learned now? You said you started your career in your 20s. What do you know now, which you didn't know then?
I think more the startup journey, when I developed the telecom company, I didn't have a really good understanding of, exit. What's the right time, and I never spent enough time thinking about that. And I think I shared this in other podcasts before, that I think I was caught by surprise when the offer to sell the company came, which would not have happened if I, had, spent some time thinking about it. So my, 2 cents for other entrepreneurs out there would be, always think about, what's your exit strategy,
Even right from the beginning.
Yes, of course, I'm not building a company to sell in 1 year. That's not the idea. We're always thinking of the mission, right? We want to reshape the future of diagnostic. That's the mission. And we don't want to think about exiting. It's kind of like separation from your baby, right? But you don't need to spend time thinking about it, because maybe the way you're gonna really fulfill the mission faster and with a bigger impact is sometimes allowing an acquisition to happen. Think about it. And in our situation, I think acquisition is probably one potential outcome. I don't know what time frame. I believe what's going to happen is, once we get our regulatory approval, we're going to start receiving a lot of proposals, right? And then what we have to do basically is, be very mindful of our stage, where we are, where we want to go, and see, if those proposals help us to reach that mission.
Interesting, very interesting, and very useful for the listeners to hear, because we do have a lot of listeners who are thinking to go into startups as well, listening to the channel. Two more questions for you here, Sergio. In regards to more of a personal note, if you were to sit down and have dinner with three people, who would you choose and why? What would be your kind of legacy three?
I would love to speak with Bill Gates. Bill Gates is one, usually people involved with healthcare.
Mm-hmm.
No, but I believe that would change over time. Right now, my mindset is like, who would be the people that could, contribute with what we're building? I really did not think about it, but the first person that came to my mind was Bill Gates for everything he's doing in the healthcare space. I would need to think a little bit more to find the other two.
Doesn't he has a big influence? I can't remember how much is connected, but with the WHO, World Health Organization as well, if I'm correct there. And the last question for you then, Sergio, would be, what do you want your legacy to be?
I want to be recognized as a person who helped shift the diagnostic space in a different future, different reality than we are today. But I also want to leave the world a better world for my daughters.
Amazing. Sergio, thank you so much for coming on. It's been a pleasure to pick your brain, everyone. A founder and CEO of Radiolife. Sergio, thank you.
Thank you for having me.